Hi, my name's Grant Gibson, and in this video I'm going to report on an evaluation of a network of 6 peer support projects funded by the Life Changes Trust as part of their peer support programme. I was a member of a team of 3 academics, myself, my colleagues Dr Catherine Pemble and Dr Jane Robertson, as well as 4 community researchers who worked with us, Leslie Aitkenhead, Rog Harrison, Kim Strachan and Sheila Thorburn. In this recording, I'm going to discuss the project and its methods before presenting some of our findings regarding the success of the peer support programme in providing peer support to people with dementia and to their carers. So to give a little bit of background, in 2015, the Life Changes Trust launched a programme to fund peer support projects, and as part of this programme funded 6 projects providing peer-based support to people living with dementia and unpaid carers across Scotland. The 6 projects provided a variety of forms of peer-based support and did so using a variety of initiatives and activities. Some of these activities included peer-to-peer mentoring, support groups, and peer-focused activities such as walking groups, cooking sections, or gardening projects. The specific goals of the peer support programme were to keep people living with dementia and their carers more socially connected with others, to give people living with dementia and their carers more confidence and motivation to participate in their communities, and to help people living with dementia to feel valued by being listened to and being able to help others with similar experiences. And all this had the ultimate goal of helping people with dementia experience a greater sense of confidence, of independence and well-being, as well as being able to exert more control and more choice over their lives. So for the peer support project that we were commissioned to evaluate, our evaluation project goals were 1, to determine whether and how peer support contributes to better lives for beneficiaries of the initiatives, as well as for their family, friends, and for the community and society more widely. To identify and demonstrate good practice in delivering peer support with a specific focus on the facilitators and barriers to successful and effective peer support, forms of partnership working exhibited by the various peer support projects, and how the projects sought to sustain their services and to achieve sustainability and long-term impact. Finally, our goal was to disseminate evidence about what works for effective peer support to promote greater awareness and learning around peer support activities across Scotland, and to really sort of demonstrate the benefits and the beneficial effects of peer support. We included 6 projects in our peer support evaluation. I won't talk about these projects in detail. There's more detail in the report that's been circulated at this event as well. 4 of the projects managed to continue for the lifetime of the 5 years of funding. 2 of the projects, unfortunately, Enable Scotland's Cuppa Club and Health in Mind's A Sense of Me project did have to close early. So our evaluation focused predominantly on the 4 organisations that carried on for the length of the programme, but we were also able to draw on some information collected from Enable and from Health in Mind as well. So to describe our methodology, one of the key characteristics of our methodology for the evaluation was that it was co-produced with our 4 peer researchers. The people I mentioned at the beginning of this recording were all older people involved in community programs, including peer support programs for older people, for people with dementia. Many of them have worked with us on a number of co-produced projects in the past and have developed real skills and expertise as community researchers doing research with people with dementia. We used a variety of methods within our evaluation. First, we carried out a secondary qualitative analysis of the various forms of self-evaluation data collected by each of the projects. One of the characteristics of any project funded by the Life Changes Trust is that they go through an extensive process of self-evaluation, and we were able to use that data within our own analysis. This was complemented by a series of 21 semi-structured interviews views with project beneficiaries, project staff and volunteers, as well as 6 focus groups with project staff and volunteers as well. We also complemented the qualitative data collection with a social return on investment analysis, and I'll talk a little bit more detail about what this involves later on. And this culminated with the production of the final report that's being launched today. And in this report details the findings of the project in much more detail than I'm going to talk about today, and gives detailed findings for each project as well as across the entire peer support program. I'm not going to talk about this in too much detail today, but it is fair to say that the COVID-19 pandemic did lead to significant challenges for our evaluation and significant challenges for all of the peer support projects. This did lead to some substantial project redesigns, and it did affect and reduce the scope of what we were able to originally do within our evaluation. So I just wanted to be clear about that. So we identified 4 key factors that influence success across the peer support projects, and I'm going to talk about these cross-cutting factors over the next few slides. So the first was the importance of staff and staffing, and unsurprisingly, staff were always going to be crucial, but this very much was clear from our analysis. Staff were valued as being empathetic, as being trustworthy, knowledgeable and accessible, as well as displaying a high degree of commitment and adaptability. There was certainly a strong sense of staff going the extra mile to meet the needs of their clients, and this can be seen in the quote presented here. One issue that I would raise that did arise that was a barrier to organisations, however, was that high degrees of staff turnover were a pretty common experience amongst the projects, and this could cause significant difficulties in terms of continuity of service and in terms of continuity of contact for project clients. Our second theme relates to funding. Unsurprisingly, funding is a big issue and continues to be a big issue for these kind of community-based projects. And we did find that even taking the 5 years of funding that projects were able to gain from the Life Changes Trust, which is a really long sustained period of funding, many projects were still found themselves dependent on chasing short-term funding sources, and this meant that a number of the projects could find themselves being quite precariously placed, and it did have a role in why 2 of the projects had to close their doors before the end of the programme. Staff needed to spend a significant amount of time chasing funding, making applications to various organisations, which could well mean that they couldn't spend that time with their clients, and it could also mean that organisations could see each other as competitors, and this came through at times, although it was also interesting and stark to find that many of the organisations did coordinate and share information about the availability of funding with each other. We also found that these kind of funding issues were very much exacerbated by the COVID-19 pandemic, not least because projects were finding themselves having to significantly redesign their services, needing funding to support that at a time when many funding sources actually started to dry up. Cultivating partnerships and networks with other organisations was a key element of the projects as well. Unsurprisingly, all the organisations we worked with found themselves part of a much wider ecosystem of both state and third sector support agencies and community organisations. So how these organisations fitted in with this wider ecosystem was important in determining the success of those projects. All the projects described developing a range of networks, partnerships and collaborations, and these were very much vital to their ability to both access and support their clients. But one finding that did come out from several of the projects was that when this involved integrating with particularly statutory services such as health and social care, this could be particularly challenging and time-consuming to build these networks and relationships, and this could be a bit of a barrier at times for organisations being able to reach the clients that they needed to reach. Encouraging peer participation was a key goal of the projects as well. Clearly, given the focus of the projects on providing peer support, being able to bring in people with dementia to provide that support to each other is a key aspect of the projects. But we did find that many of the groups found that they were most successful if they were able to access people relatively early in the dementia journey. But this could be quite difficult because many found that people didn't engage with the projects until they faced often quite severe need. Creating safe and supportive spaces as well as networking with neighbouring organisations was a key aspect of how they addressed this difficulty. But we did note that some carers in some of the organisations expressed a tendency for groups to avoid what they called hard questions, avoiding topics that might be seen as difficult or sensitive to deal with for people at different stages of the dementia journey. And this did suggest that there was a place for different types of peer support to be offered within a single organisation, and this was something many of the organisations did. So moving on to our social return on investment analysis, and to give you a little bit of background about what a social return on investment analysis is, it's a form of cost effectiveness analysis and a cost benefit tool that can be used to identify the level of social value that can be generated by community-based activities such as peer support. The way that it does this is by attributing a financial proxy amount in pounds that represents the social value of some of the outcomes from a particular activity or a particular project. We went through an exercise of collecting data from the various projects about their outcomes and the benefits they had for their clients, and we were able to use this to generate the social value calculations displayed here. And what was significant is that we see that across the organizations, all 4 of the organizations we were able to do an SROI for demonstrated clear social value. They clearly led to increased social value when compared to the level of investment in them. At its smallest, we saw this being where £1 of investment led to £4 worth of social value, and in the highest, we saw £1 of investment leading to £15 of social value. Now, it is important to note that a higher social value does not necessarily mean that that service is better than the other services. The level of social value determined by each of the services very much depended on factors such as the number of people they were able to access, the range of activities being provided, but also the scope of the projects. And some projects, because they chose to focus on particular groups or particular ways of providing peer support, that meant that for some services the social value was higher than in others, but that doesn't necessarily mean that one project is better than another. So bringing this section to a conclusion, what did we feel were the main factors that influenced the delivery of peer support projects? Well, we identified sort of 5 points along the sort of the timeline in which peer support projects were developed. So first, at the initial phases of setting up projects, we found that it was important for projects to clearly identify a purpose, clearly identify their client groups, and clearly identify their aims and objectives, as well as identify mechanisms and tools that they can use to actually measure and determine what the benefits or what the outcomes of their projects are. A key element of this was these early stages was also communicating the goals of their particular projects and activities across the local network of community organisations, as well as focusing on recruiting the right staff as soon as possible. At the next stage of project inputs, we considered that ensuring that there's a consistent supply of funding to these organisations and staffing to these organisations is pretty crucial. Current funding setups do mean that it can be difficult to achieve both of these elements, and this might require a rethink of actually how community organisations such as the projects are funded. More widely, we found that it was important for projects to start to build their own networks and collaborate with other organisations, and we found that reciprocity of helping other organisations in the hope that they would help them as well seemed to be the mechanism through which these kind of relationships could be built. At the stage of continuing project development, we found a key goal was moving towards sustainability, particularly in relation to funding sources, as well as ensuring that projects are accessible to the range of stakeholders and clients that they've identified and can continue to develop that community reach is also a key element as projects continue to evolve and develop. In terms of the activities and outputs coming out of each project, we felt from our work that it was important to tailor support to individuals, to ensure that there were safe and secure environments, both sort of physically but also emotionally, for people to be able to engage with each other and to engage with the organizations, as well as building strategic approaches across the networks that they have of knowing which partners they wanted to work with and which partners could help them in which specific ways. Finally, in terms of reporting things like benefits and outcomes, we found that it was important to share information and resources about the projects, as well as sharing the lived experience of clients and peers and their experiences of taking part in the projects as well. Both of those were clearly important in terms of being able to state what the outcomes of a project are. And then finally, and once again, continuing to build that community engagement so that the benefits of the projects can be shared with other organizations and within other communities. So that's the end of our presentation. I hope you found it interesting and useful. There is a Q&A session later in the day that I'll be a member of the panel for that, but if any of you would like to contact me directly, you can reach me on Twitter at Dr Grant Gibson or via my university email address at grant.gibson@stir.ac.uk. So thank you very much, and I hope you enjoy the rest of this launch event.